Hello, welcome to Therapy Clips with Dr. O. Today, our video presentation will explain to you exactly what cognitive behavior therapy is all about. So what is cognitive behavior therapy? Basically, it is a psychotherapeutic approach to treating mental and behavioral health conditions. Now, CBT is what you will hear when you're talking to clinicians like myself, or if you're in a classroom or workshop setting, you will often hear people speak of CBT. So what does CBT do? It's been demonstrated to be very effective and can lead to significant improvement in functioning and quality of life for several conditions and life situations. So CBT can be used for substance use disorders, anxiety disorders, depression, post-traumatic stress disorder, eating disorders, relationship conflicts, coping with medical illness, and severe mental illness. And I will venture to say that the disorder, as far as mental disorder is concerned, doesn't always have to be severe. Because I don't want anyone to think that because you are using CBT, then you have a serious mental health problem going on. So you can really use CBT for disorders like anxiety and depression. Okay? And it may not even be that severe. So I don't want you to be confused just because you hear it in this presentation. Basically, when you think about CBT, you think about changing the way you think from negative to positive thinking. That's the gist of what this particular therapeutic approach does. When you are working with a therapist, when you're reading literature, when you are attending workshops, you are learning that you can change your thought patterns. And you do not have to stay within the frame of thinking that you may be in, especially if that thinking is negative. It also gives you an idea of how you may react in certain situations that confront your daily life. Now, some people may have a situation or an event to occur, and it will devastate them. And other people may have a situation or a thought to occur. Some type of event has triggered this particular thought, and they are still calm, cool, and collected. Because it all stems and relate to how you perceive the situation. Now, you may see a situation like the loss of a job as devastating. And nothing in this world can be done to help you. That is negative thinking. And that thinking can change. Yes, the situation is the loss of a job, but you can always think in a positive direction. That before the end of the month, I will get a new job. So you see, it's a matter of how you are viewing the particular situation or event that is going on in your life. So we have situation that leads to a particular thought. It could be negative, it could be positive. Then that will trigger your emotions. When your emotions are triggered, you may demonstrate particular behaviors that are associated with the emotion and the thoughts. So that is the model. That is the CBT model. Let me go over it again. You have a situation that leads to a thought, that leads to emotions, that leads to behaviors, that lead back to another situation that is related. So it's almost as if it's going in a circle. When particular situations occur in our lives, and there is no intervention if an intervention is needed. An intervention really disrupts the way that a person see a particular event or a situation that may have occurred in his or her life. So at any point in the circle of situation, thought, emotion, and behavior, there could be a disruption or interruption in the way that you think about that particular thing. What I do when I work with people in therapy, I say you're thinking in a negative way. I want you to change the channel. Just like you would do if you're watching TV and you see something on TV and you say, I don't want to see this. This is boring. What do? You change the channel. Okay, so that's what we teach you in CBT. CBT stands once again for Cognitive Behavior Therapy. Now, you do have some core principles that is related to CBT. These principles says that psychological problems are based in part on faulty or unhealthy ways of thinking. In other words, the thinking patterns are negative, and that would be unhealthy for the individual mentally and emotionally. Okay? The next core principle says that psychological problems are based in part on learned patterns of unhelpful behavior. What this means is that you have learned to handle situations in a particular way. Sometimes we learn to handle situations in a negative way. Sometimes we learn to handle it in a positive way. So, it's based on your patterns of how you were taught by what you've seen in your environment, like in your family environment, or any other type of environment in which you have gone to school, gone to church, hung out in the community. We see models, and these are people who are demonstrating particular type of behaviors around us each and every day. So you may have picked up on some of these behaviors just by learning from the model. So we're going to move on into the third and the final principle of CBT. People suffering from psychological problems can learn better ways of coping with them, thereby relieving their symptoms and becoming more productive in their lives. Yes, you can. And yes, you will. Because once you listen to this presentation, you can come to realize that yes, as a human being, you're going to be faced with issues. No one escape it, even me. But the difference is that most of the time, a group of people may know how to handle the situation and not let it devastate them, depress them, or cause them to be anxious or angry or stressed out. So yes, you can change your situation just by changing the way that you think. change your thought patterns the moment that you notice that these thought patterns are negative. It's not going to do you any good to stay in a negative way of thinking. Okay, I love these core principles. Straight to the point so that you can understand exactly what your direction should be. And if you don't know, Dr. O is here to tell you. Let it be positive, please. Positive thinking. That's what it's all about. Because the more you put positive energy out into the universe, into the world, positive energy will eventually come back into your life. All of a sudden, you see things are going the way that you want it to go. And sometimes life will present situations like you walking down the street, you need money, you look down and there's $20. Okay? That's the law of attraction, that you are bringing in positive energy into your life just because you're thinking and behaving in the appropriate way. But not only that, you are learning to control your own emotions. Now, I want to move into some core strategies that is related to cognitive behavior therapy. And that is, once again, CBT. So, core strategy number 1, learn to recognize distortions in thinking and reevaluate them in reality. Pay attention to your thought patterns is what's being said. Next, gain a better understanding of the behavior and motivation of others. See, sometimes your life can be going the way that you feel as though it should be going. Again, it's a matter of perspective, how you think your life should be going. And then you have people who are around you who influence the way that you're thinking about how your life should be going. Sometimes it's for the good and sometimes it's not. You need to be able to recognize when it's not for your better good. Because see, after all, you are working in therapy to promote goodness in your life and changes that will be for a better quality of life for you. Next, learn and use problem-solving skills to cope with difficult situations. In the past, I presented you with a problem-solving video, but I'll just go over briefly exactly how to solve a problem. Whatever the problem is, you think, I have a problem. That's number 1. Number 2, you say, what are some possible solutions to solve this problem? So you make a list of how to solve the problems. So you may have 3 or 4 things on a list that could work for your particular problem. And then the third thing you do is you choose one of the things on your list. You try it out to see if it solves the problem. If it doesn't, you move to the second thing. If that doesn't work, move to the third thing, and then try another alternative if you run out of solutions. Okay? So problem solving is not that difficult. So that's what we do as adults. We have problems. We don't lay around and become depressed about it. No. We think of solutions that we can possibly choose that will help us to solve our problem. So the next thing is that please develop a greater sense of confidence in your own abilities. I am here if I am working with you to resolve some of these issues with you. We can brainstorm some of these solutions together and we can say, well, try this, try that. Did it work? Did it work? Okay? So I am here to be your support person. But as an adult, It is your responsibility to take responsibility for your life and the movement of your life in the direction you would like for it to go. So, for example, you may say, I don't have any job skills, so I can't get a job. Well, it becomes your responsibility to look into different types of programs that will give you job skills. It could be a CNA program that lasts for 3 months. At the end of 3 months, you will have job skills and you can go out and look for a job. So see how it goes. Any clinician, counselor, therapist who working with you can give you the tools to put in your toolbox so that you can utilize these tools to do the things that you need to do for yourself. You cannot wait around for someone to always do something for you. In order to get things done, you can speak with your therapist, your counselor, or you can speak with any friend or anybody that's a part of your church group or your school group. And they may have suggestions for you, but it's really up to you to implement what will work for you or what you think will work for you. So implementation is very important. And that is a big word, but it means do something in order to help yourself to move along in a positive direction that will promote goodness for your life, bring good things to your life so that you can have the best quality of life that you can. So let's talk about the next strategy that's on the list. Face your fears. Face your fears. Don't avoid it. Just go ahead and say, you know what? I don't think I will do well in a particular area. So, for example, I have to improve on my statistics. See, there's something that everyone needs to do. So last semester, I took a class to improve upon my statistics. See, I had a problem. I went out to try to solve it. I said, let me take a class in statistics. Well, I learned a lot, but not as perfect as I want it to be. Not as good as I want it to be. It doesn't have to be perfect, but it has to be good enough so that I know what I am doing. If I ever have to use statistics or read about statistics. So I faced the fear. Oh, statistics is such an overwhelming class until I said, oh God, will I get through this class? Will I get through this class? And every day I sit back and I had to motivate myself in order to try to make it through the class. And I did. I made it through the class. I stayed the entire class, no matter how rough it was. I faced my fear. Now, that is what I need you to do. In your life, I need you to face your fears. Because eventually, something will work out for you if you are consistently working on the issue. Now, another strategy that you could use is what we call role play. Role play is all about a scenario, a situation, event that you're trying to work through. And so you stand in the mirror and you talk to it. Let's use going on a job interview as an example. Most people feel anxiety when they're going on a job interview and they're sitting in front of the person who will judge whether or not they will get the actual job. It is stressful and it is anxiety provoking for most people. That is a normal situation. Well, prior to going to the interview, you can stand in the mirror and you can practice how you will respond to the interviewer who is asking you the questions. Okay? So that's what we mean by role play. You can learn how to work through a lot of situations if you engage in role play and think out how you will handle particular problems. And the final strategy is to learn how to calm your mind and relax your body. And of course, if I'm working with you, I have given you so many relaxation techniques, videos, avatars, worksheets until you should be a pro at it by now. But if I am not working with you as an individual and you just so happen to listen to this video presentation, you can find worksheets on the internet. You can look through YouTube and listen to presentations that are placed there by clinicians like myself. So there is always a way for learning to occur that will help you to manage situations that you may have in the area of substance use disorders, anxiety disorders, depression, post-traumatic stress disorder, eating disorders, relationship conflicts, coping with medical illness, severe mental illness, and guess what? Even anger management. This is Dr. O. Thank you for your time.